Hello, I'm Dr. Wesley Barry. I'd like to speak to you today about gallbladder problems. The gallbladder is a saccular organ that sits beneath the liver. Its only purpose is to store bile from the liver. When needed, it is excreted through a tiny duct into the duodenum to mix with certain pancreatic juices and break down fatty foods. When it dysfunctions, it's either because it has stones, which happens about 85% of the time, or because it is dysfunctional, called biliary dyskinesia. We test this by way of ultrasound, and we test the function by way of what we call a HIDA scan. This scan causes the gallbladder to contract and lets us know if it excretes at least 35% of its content. These tests allow us to know if you do indeed have significant gallbladder disease that requires surgical treatment. The symptoms of gallbladder disease are pain, sometimes in the epigastrium in the right upper quadrant. This pain may be crampy in nature. It may radiate to the back, can also radiate to the chest or to the shoulder. It may or may not be associated with nausea or vomiting. May or may not be associated with decreased appetite. It comes on frequently in association with some type of fatty food intake, be it fried food, milk or milk products, or red meat. The acute version of gallbladder disease is accompanied by fever, sometimes chill, and a much larger illness. The treatment for gallbladder disease, the gold standard is to remove the gallbladder with a laparoscope. Many years ago, we did an open operation to do this. Now, we're able to do this with actually 4 very small incisions, the largest of which would be about the width of my thumb. The operation takes about 20 to 30 minutes of actual surgery, and 99% of patients go home within the same day. After surgery, your only real restriction is a low-fat diet for 1 month. Most patients are able to return to their work activity within 1 week. In this practice, we perform this operation well over 4,000 times, and we certainly appreciate the opportunity to take care of you. We look forward to taking care of you. I'll explain further when I come back into the room to speak with you and your family. Thanks for coming.